Good evening, and thanks for joining me tonight. My name's Colonel Jason Condrey, and I'm the U.S. Army Garrison Stuttgart Commander. And I've got quite a bit of information to share with the community tonight. And with recent increases in cases, both in our community and of course in the area surrounding our community, and some advanced notice of host nation restrictions and measures that some have already gone in, but many will go in at the beginning of next week. I think it's important that I sit down and provide as much information to you as possible. So I'll offer a quick COVID update. I'll talk about some of the ongoing efforts with the clinic and our public health team. I'll talk about some of the closures that will happen in the local community and what that means, what that amounts to for us here on the garrison. And then I'll provide a couple thoughts on how what we're experiencing now is a little bit different than what we saw in the spring. And then I'll get into some of the questions many of you provided in advance of tonight's live stream. So in terms of COVID, I think our docs would characterize what we're seeing as transmission that is widespread and sustained. As I look across Baden-Württemberg, you've got 40 of the 44 districts or cities that have a 7-day incidence rate that exceeds the 50 per 100,000 that serves as the emergency brake. 15 of those are at 100 per 100,000, so double the emergency brake level. And so, of course, those include Esslingen, Ludwigsburg, Tübingen, Stuttgart. Just today, Boblingen dropped down just under 100, but still well above the 50 per 100K. And what we're seeing is that we're spreading the virus at work. We're spreading the virus at weekends, either while kids are playing or at a party or at a gathering. And when we can't isolate an infected family member from the other members of the family, it works its way through the family pretty quickly. In the last couple of weeks, 2 out of every 3 people that have gone through the drive-thru have had some sort of symptom. Sometimes it was pretty mild, but still, nonetheless, they thought they might have a cold, may have an itchy throat, a tingle, loss of sense of taste or smell, something that just wasn't right, and they made the decision to come and get tested. Many that tested positive were surprised by that result. And I think what proved to be very concerning was the fact that many of them could not trace back to a person or an event that likely led to their infection. So a significant increase in transmission, both within our community and in the area surrounding us. The increasing inability to trace the source of that infection and isolate it. And of course, local officials across Stuttgart, across the state of Baden-Württemberg, that were increasingly saying, don't mix with people that you don't have to. Interact less. And some specifically talking about trick-or-treating, Halloween events, parades. And so that led to the decision not to have trick-or-treating on the installation this year. And I know that was hard. That was not an easy decision. And I know that made many people unhappy. I can tell you that the first question I got was, do you hate kids? And that came from my 9-year-old. Every time we looked at a way to try and structure something for our community to do on Halloween, we very quickly found ourselves in direct contradiction of the host nation's event guidelines. And so as we looked at all the different ways and found out why we couldn't do it that way, that led to the decision. So we will not be doing door-to-door trick-or-treating this year. I know that there's some events, some structured events that are part of the school day, and I know that families are incredibly creative and have found a way to replace trick-or-treating in a way that doesn't require you to interact with people outside of your family, outside of that bubble that you are in. You will increasingly see the MPs out, but that's not focused on Halloween. That's focused on some of the things you've been seeing with current events. On Halloween, I'm relying on parents to keep kids at home and not ringing doorbells up and down the streets of our installation. So clinic, lots of effort going on with our clinic team, working in close coordination with our school nurses, our school administrators, our child care facility administrators, and the command surgeons teams and medical professionals across the installation. And there are lots of questions and confusion about terms guidance, and especially as people compare their situations with the situations of their friends, their coworkers, and even their neighbors, because things aren't the same. They're different, and depending on when someone was sick, there's a reason for the difference. Are the same. Conditions have changed. Understanding of how to do things better has changed, and as a result, guidelines have changed, and without much notice. And so that's fueled the confusion. And I recognize that and apologize, because I know that's created some concern. So in an attempt to address questions, confusion, kind of align all of the guidance on testing, isolation, quarantine, return to work, return to school, the clinic has developed a set of guidelines and a set of instructions that you will get when you go through the drive-thru. And it'll be no different for each person. The box check may be different depending on what conditions apply to you or your family. And so those are a result of the collaboration between our clinic team, our public health team, the command surgeons across the installation, people here at the garrison trying to help alleviate some of the confusion. And last night, the clinic commander initiated a parent-family community council where she introduced these guidelines and these instructions to the people that will be using them to try and get some feedback. What's confusing? What needs to change? What kind of problems have you seen? And so got some great feedback from the participants of that event last night. And with that has gone back to the medical experts, and hopefully tomorrow we will publish those so that everybody has what the conditions are. Please understand that as our understanding of the virus changes and perhaps the conditions change, so too will those guidelines change. But that will be our intent, is to have a set of terms, guidelines, instructions that ensures there's not much difference between one family to the next as they go through and get and see a doctor in our COVID screening drive-through. I will tell you that all along we've reported our cases to local health officials, the Gesundheitsamts, and depending on where you lived was who we reported that to. Boblingen, Ludwigsburg, Esslingen, Stuttgart, and each one of those places has a different process for what they do with that information and the information they require. So we've worked hard with our trace team to give them information, to provide close contacts, and what we have seen more recently is that with renewed effort on the German side to conduct tracing and to ensure people remain in isolation, that we have families, individuals that have been reported to the Gesundheitsamt that have received contact from those German officials. So, right to be wary, especially if someone calls you and asks about your specific information. But understand that that is a process, and depending on where you live, there may be engagement by German health officials to ensure that what we say we are doing, that is actually happening. With respect to testing, we will continue to test any member of our community. We're not focused on whether or not you're a TRICARE beneficiary, not asking that question. We're going to prioritize the use of our local testing capability as long as we have the capacity to do so on people that have symptoms, followed by people that are known close contacts with positive cases. Our tracing is coordinated with units and headquarters. It's coordinated with the garrison team. It's coordinated with the school and child care centers. Ideally, as soon as we know of a case and we know where the links are, in all directions we are communicating and letting parents know, hey, don't come to school tomorrow. Don't bring this child in tomorrow. I want to start talking about some of the host nation changes and what that might mean for our community. So, as we've listened to Chancellor Merkel make her press conference, heard some things from the Minister President here in Baden-Württemberg, Mr. President Kretschmann, there's a deliberate effort to avoid declaring a national public health emergency here in Germany. And parallel to that, an effort to do something now in order to potentially save the ability for families to celebrate Christmas with each other and travel across Germany. And so you can expect some very restrictive measures for the entire month of November. I know that they've established a couple times when they will stop and deliberately look at whether or not the measures are having the desired effect. But with that end state in mind, avoiding the medical system being overwhelmed and trying to find a way to allow families to enjoy the holidays together, there's going to be some fairly noticeable measures in place for the next 30 days. And so the state parliament will convene a what they call an extraordinary parliamentary session tomorrow. And the result of that session will provide some of the state-specific guidelines on top of what's already been published and will be implemented across the entire country. So what hasn't happened yet is the revised publication of the ordinances that will allow us to dig in and find out some of the specific nuance and some of the specific detail. And so I'll hit some of the restrictions, some of the measures, and what that might mean, and highlight where things may change. So in terms of restriction of contacts and events, the intent is that we find a way to reduce our interactions with other people by 75%. So where you would meet 4 people in a day, find a way to reduce that to 1. Indoor, outdoor, private events and gatherings are limited to 10 people and not more than 2 households together. There are restrictions on lodging. There's no tourist travel. If you are going to another place, it needs to be for an essential reason. Leisure, so leisure establishments such as theaters, operas, concert halls, trade fairs, cinemas, parks, casinos, all of those will close. Fitness studios, swimming pools, amateur and club sports facilities are closed. Sports clubs, not permitted to train. Individual fitness training is still authorized, such as running, walking, biking. As a result, we will close our NWR bars. We'll close the bowling lanes, the golf course, fitness classes, and our gaming rooms. We're working with host nation officials to continue to use our fitness centers as it's linked to our mission and the readiness of our community. We'll also clarify if school sports, specifically the winter sports that have just been announced, and our instructional skies programs can continue, given the ability to provide some structure and the enhanced mitigation that will go with all of those activities. Events, so anything serving entertainment purposes are prohibited. Professional sports are only allowed if there are no spectators. These kind of limitations will affect things like unit turkey bowls, stuff that we've always done in the past. And of course, we always have an Army-Navy flag football game here in December. That one may not be possible either. Restaurants, bars, clubs, discos, taverns will close. However, takeout and delivery of food is still possible. We believe our workforce canteens and the DFAC may remain open, but AFES food courts, the Galaxy Bowling Center will move to takeout and delivery only. Services such as cosmetic, massage, tattoos, studios will close, although medical treatments and therapies will be able to continue. So for us, our barber and beauty shops will remain open, but some of the additional services may not be available. Supermarkets and shops. So retail stores are to remain open, although the number of customers will be limited to 1 per 10 square meters. So I've asked AFES, our commissary management team, and all of our service providers to review capacity limits. And I'm asking you to help adhere to those capacity limits. In most cases, that's a cart, a basket, something that helps control the number of people in and out. And if there isn't a cart or basket there, don't go in. Wait for one to come out. Schools and child and daycare centers, they will remain open. Religious services will continue. The capacity for indoor services will comply with host nation distance and hygiene and sanitation mitigation requirements. And I know the RSO team is looking at how we're going to do that in each one of our chapels. Workplace safety. So businesses are required to establish and implement hygiene plans tailored to their business, their workforce, and do a current assessment as to whether or not they can improve the mitigation. Teleworking, where possible, should occur. High-risk groups. So high-risk groups such as those in hospitals or nursing or elder care facilities, they're going to work hard to protect them, but at the same time not create some of the isolation conditions that we experienced in the spring. And then in terms of controls and inspection, so there will be deliberate efforts to control and inspect and check for compliance on all the protective and quarantine measures. That's especially going to be true at all the border areas where you've seen some of the cross-border traffic. So I think what's an important question that many are asking is, what's different now as compared to the spring when we also had widespread and sustained community transmission? Why aren't we back in red, white, and blue? Why aren't we doing more? Why aren't we locked down? Why aren't schools closed? Why haven't we moved to HPCon Charlie? So I'll offer a couple of thoughts. So we have continued to learn and improve. We know more about the virus now than we did then, and we've refined how we protect against it, both as individuals, in our workplaces, in our service areas, as a community. In the spring, COVID was the mission. Now it's something we recognize as part of our environment. We've adapted how we work and how we live in that environment. And we will continue to do so because the mission, the reason why we're here, hasn't changed, hasn't gone away. So things are more difficult. Just the other day, I counted 10 additional steps I had to take in order to go get a toothbrush in the PX. Protecting yourself, protecting your family, protecting your coworkers, it's hard. And many people are tired of doing all the things necessary to keep that level of protection up. I understand you're tired, but we're not done yet. We know that you cannot eliminate the risk unless you can somehow find a way to completely isolate yourself from contact with other people. And you can also do all the right things and still find that you have been infected with the virus. We've got lots of mitigation in place. Over 10 kilometers of plexiglass are up in this garrison. We have hand sanitizer in large enough supplies that I'm now as concerned about the fire hazard that its storage presents as I am about keeping the containers in the outside of all of our service areas full. People are wearing masks, they're keeping their distance, and they're keeping hands and all those community touch areas clean. Service providers have implemented redundancies that are designed to prevent a service from halting if somebody gets sick or goes into isolation or quarantine. And if they do, it's for the smallest time possible. Our clinic capability continues to evolve. We test locally and can have results within an hour. We have credentialed volunteers that have stepped up to either fill some gaps in COVID testing and or other functions across the clinic that they might not otherwise be able to do because a third of the team is focused on COVID. When it comes to groceries and retail shopping, the commissary's distribution center has 30 days of supply and no foreseen interruptions in distribution. For both AAFES and the commissaries, while they don't have any supply or distribution interruptions, manufacturers have experienced some difficulties related to meeting demand. I'll use Clorox, making more Clorox wipes and microchips for certain computers as an example. That's going to affect the availability of those things on the shelves here in our stores. And then there's also instances where there are shortages of raw materials. Shortage of aluminum means we don't have as many canned goods and we don't have canned soda on our shelves. We've got a fantastic volunteer program that's in place, and each and every day more people sign up to help somebody that may need their assistance using the commissary's concierge shopping program or going to pick up an AAFES buy online, pick up in store to bring it to somebody that's in isolation or quarantine. These are all the kind of things that allow us to remain open, remain focused on our mission, and to maintain some sort of normalcy. So I'll get into some of the questions you put in advance. Quite a few came in, and so I'll work through those as quickly as possible because I know there's some additional ones that have come in while I was speaking. So a couple on Halloween. So Katie asks, any guidance for community members regarding off-post trick-or-treating? So from a host nation perspective and from all the local officials that I've seen guidance from, they are asking people not to trick-or-treat, not to go door-to-door, not to do parades. And so understand that if you are out doing that, there is a good chance that the Polizei may have an issue with you going door to door and not meeting the intent or the spirit behind the measures that are about to go into place. Got quite a few questions regarding Dodea. So this question came from Barb. With German lockdown, are there preparations in place for kids to get their books and Chromebooks home before the schools close? As all the kids and my husband will be home, we'll be running short on technology again. Last time there's a lot of going back and forth to get everyone required from each school. It may not be possible depending on restrictions. So first of all, Barb, we're working really hard to keep schools open. And so the staff at the same time is preparing for at-home learning for individual students or perhaps even a class that has to spend a period of time at home. And should there be a directive to close our schools, they are preparing to transition to remote learning like we saw in the spring. And if there are families that don't have either the ability to have a child on a computer or don't have internet access, just as we did in the spring, the school is prepared to work individually with each family to meet their education needs and to ensure that the education that they've received thus far continues. So Katie, question said, could you please give the details regarding what happened with a positive case at the high school? Specifically, did the virus spread in the high school environment with mask and social distancing regulations in place, or did the mitigation efforts in place work to stop the spread of the virus? So Katie, I think you will find that we are deliberately vague in giving guidance or giving feedback on what happened and how the trace went, in so much as you're not going to find out any information that isn't directly related to your student, a member of your family. But as I look at a whole at the positive cases that have been linked to our school, we have not found a single case where interactions in a classroom are the reason why we believe spread occurred from one student to another. Now, that doesn't mean that we didn't have two kids in the same classroom that tested positive. But as we looked at their activities, both in the classroom and then, of course, the time they spent together outside of the classroom, we assessed that playing sports together, a sleepover, a movie night, those are the things that created the persistent close contact that led to the spread of the virus between those students. Tracy's question is, can the guidance of classroom contacts automatically having a 14-day quarantine be reevaluated? If my child sits more than 6 feet away and has not had 15 minutes or any direct contact with someone who is positive, why do they still have to quarantine and or can't test out with a negative? I thought post-wide guideline was less than 6 feet apart and contact of 15 minutes or more. So Tracy, there's a couple different variables that are in play there that may drive a 14-day at-home in-person learning or remote learning. And so number one, it's our ability to confirm and trace and identify in the classroom setting who is a close contact. And we have not found any testing indications that someone that's in the same classroom with the mask on, with the right distancing, has had the virus spread to them. But if a close contact of that student is a teacher and there isn't the ability to put a substitute teacher in place, then there may be no option other than to send the entire classroom home and do virtual or remote learning. And so as long as we have the ability to test and have the local or have the capacity to do local testing, then the intent is to continue to pause, do an assessment, do a tracing, complete that, and then resume instruction where that's possible. It may not always be possible, but as an example, today or yesterday, we paused instruction within the middle school to do contact tracing, both for faculty and staff and students that had contact with positive cases within the middle school, and determined that we were able to resume instruction. Joanne asks, can you please speak on winter sports? Many of our kids were excited to hear volleyball was moved to the winter. I assume it would be canceled with the new guidance to be in line with German policy of no sports for November, but some clarity would be appreciated. So first, Joanne, first practice is scheduled for 16 November. Spoken with the superintendent, and there may be the possibility to move things to the right and still have those winter sports. It may also be possible, as we receive the specific guidance that comes out of the coronavirus ordinance, the updates to that we don't have to cancel the structured winter sports. And so I know we've got volleyball, we've got marksmanship, and we've got weightlifting that the high school is looking to offer. The safety and protection of the students is always going to come first. And so if we don't assess that we can do those things safely, then they will be canceled. But as long as the mitigation that we have in place continues to provide adequate protection, then we will find a way, if possible, to move forward with winter sports. I do want to take this moment right now to highlight that second semester enrollment for the virtual curriculum is open. It opened on the 15th of October and it closes the 6th of November. And fantastic news across all of Europe. The Dodea meal program ensures that no one has to pay for hot meals at our schools, breakfast and lunch where they're offered. So COVID testing, quarantine, and isolation, quite a few questions on this. And in addition to what the clinic's doing, I'm going to try and dig in and I've got some coaching here from our public health team to try and answer these. So I'll rely heavily on the notes here. First of all, this question came from Amanda. If someone coming to the area from the U.S. gets a COVID test a few days prior to flying and then gets another COVID test upon arrival, do they still have to quarantine for 2 weeks? Short answer is yes. Everyone that comes here from a red zone is going to have a 2-week quarantine. Test on arrival is to see if you arrived with it. Perhaps that test a few days prior didn't catch it, and the moment after you took that test, you now had enough virus in your system to be positive. The test at the 5 to 7 day mark is to see if you acquired the virus in transit. And that's important because the person that picked you up at the airport would need to go into isolation at that point. Quarantine. Gina asks, quarantining across a grade level for one positive seems extreme. What's the point of masks and the distance if we're going to quarantine an entire grade level at a time? And so short answer is not recommending quarantining across grade levels. The only time we've had to do that is when the totality of the contacts and contacts by classroom amounted to either an undetermined number of classrooms that were affected because of bus riders or extracurricular activities or a schedule change that causes students to move from one class to another. Otherwise, we're going to look to find a way to just have a positive case affect one classroom, and ideally even smaller than just that one classroom. Sarah asks, can we get clarification on the status of the families and students quarantined and isolated from a school incident? Namely, who, what, and when does the quarantine and isolation end? If the first test was negative and no symptoms present, no additional testing or medical clearance is required, can be interpreted in many ways, and families need to know whether or not they are not currently isolated. So Sarah, the first thing that I want to say is that if you have tested positive, your release back to school, back to work, happens through the drive-through. Come back through and talk to the docs there. They will release you, and if it's required for work or for school, provide documentation stating that you're released. Some of the more specifics. With respect to isolation, you are positive. Your isolation ends 14 days after symptoms start or 14 days after you tested positive if you had no symptoms. That presumes the last 72 hours you are symptom-free. No test is required for you to exit isolation. If you were quarantined, i.e. you were exposed to a positive case, a close contact, that ends 14 days after your last exposure to that positive case. Someone cannot test out of quarantine. Social distancing. So you have some symptoms, you tested negative, you were not exposed to a case, you maintained your distance. It's very much similar to the kid that sits on the other side of the classroom from the positive case. You are not in quarantine or isolation. Rather, it's what happens when someone that has symptoms that could be cold flu. So the intent is to separate that person from the household and community as well as possible. So if the first test is negative and the person feels great a couple days later, no additional testing is required and they can return to work and school. That's what you see in terms of the documentation you receive from the school nurse when someone gets called to the office if their student has some sort of symptom. So it's important to keep the terms isolation, quarantine, and social distancing distinct and separate. So Richard asks, and Sarah, I realize that you could probably watch what I just said 10 times and still be confused. That's the whole purpose of the documentation that the clinic is putting together, and we will soon publish. So you understand the definitions of the terms, and then similarly, you get some specific instructions as you go through and see our medical team that describes the timeline and what it takes to either go back to work, go back to school. So Richard asks, if a family member is exposed to a positive case, is the whole family quarantine required to take a test, or just the exposed child required to test? So the medical answer is it of course depends. If the household can separate from the exposed person, then the family doesn't have to quarantine. That's obviously a little bit, that's possible depending on how your household is arranged and the age of the child, and impossible if those conditions can't be met. So in many cases, you'll find that households will have to be creative, and you may be able to maintain that solution for a certain amount of time, and then find that you simply can't anymore. At that point, the entire household would need to enter a quarantine. So Haley asks, can you create a list of places where people can get testing off post? So there is a link that we'll provide. Of course, the link provides a German answer to this question. I think that's closely linked to, will testing off post be paid for? So right now our understanding is that TRICARE will only pay for testing if a medical provider deems it's necessary, and if our medical team is unable to provide that testing. Otherwise, you can expect to come out of pocket for any testing that you do off the installation. Got a question about flu shots. So Christina asks, are flu vaccines available to everyone here in Stuttgart? And also Megan asks, do we have updated dates on when flu shots will be available for dependents' children? And if they won't be available until December, does Germany offer flu shots? And if so, where? So 3 different kinds of vaccine. So you've got the vaccine for 6-month to 36-month. That's available on a walk-in or appointment basis at the clinic right now. Likewise, if you are 65 years or older, that flu vaccine is available at the clinic today. We received an initial supply of flu vaccine for that 3 years to 65 years age range, which is the bulk of our community. And the prioritization went for active duty service members, and as quick as it arrived, it was stuck in people's arms and gone. Anticipate getting a resupply on the 4th, and then we'll continue to get more resupplies of flu vaccine. And working with the clinic right now, between the Director of Emergency Services and the clinic team, to identify locations where we will either do a drive-through or a walk-in flu clinic to vaccinate the remainder of the workforce, vaccinate the community, and of course take it to each of our schools where, if parents choose, their student can get the vaccine there in school. So there are places off post. We'll publish that link, publish that information, and there may be an opportunity to get the vaccine off the installation. So this question is related to PCS travel and lodging. So Ali asks, if the Panzer Hotel isn't fully booked for PCS and TDY, can community members make a reservation to be away from quarantine family? Hotel said it was up to the garrison commander to make the change. So Ali, if that is the solution that works for your family, that prevents the entire family from quarantining, then I will approve somebody coming into the hotel that potentially is isolated, and we'll ask that the family continues to support that person in the hotel. Julie asks, while out processing PCS moves continue, will they continue with new lockdown measures? Julie, yes, we will continue to bring people into the community, and as needed, send them on to their next duty assignment. This is going to be official travel only, primarily PCS in and out, but there may be some instances where TDY is necessary as well, and each headquarters will make that determination as to whether or not that TDY and official travel is necessary. Jesse asks, for those civilians assigned to AFRICOM and whose spouses and or significant others are back in the U.S. and not on our orders or have SOFA status, is there a way for them to visit us in Stuttgart for the holidays? We've been unable to travel here since the pandemic started in March. I believe the German government has established a policy that allows their geographically separated couples to visit each other. So, Jesse, that's a great question. Similarly linked is those families here that have college-age adult family members that are attending school back home, that school potentially ends at Thanksgiving and won't begin again until mid or late January. And so right now, the answer is wait. I'm trying to get an answer, trying to find out how we might be able to do some exceptions. Everything that we've done thus far has required engagement all the way up to the federal level, and embassy engaging the Federal Republic of Germany to allow individual family members to come over here for emergency situations. We're looking for a way to get out of the by name deliberate process that forces us to describe why this is an emergency and needs to happen. Jen asks, is there a way that the Kelly Hotel can be used by military members who return to Stuttgart from a TDY and must quarantine so as not to disrupt the routine of their other family members? Also, is there a way that the garrison can look into this option being made free to the service members so that families are not incurring out-of-pocket costs for quarantine hotel stays that are not being reimbursed? So, short answer, Jen, is I've already discussed with several of our mission partners how the Kelly Hotel can be used to quarantine members of their organization, specifically the rotational forces that come here, are traveling and doing work in other countries and have to come back here and spend some time in quarantine. So that coordination is already done. It's ongoing. The second part of your question about whether or not I can provide that free to family members that opt to do that rather than isolate with their families in their home, the short answer is I don't have the authority to give away accommodations within an Army hotel. That would be in violation of policy and instruction echelons above the garrison, and I don't anticipate that changing, given what we have seen in the spring and the availability and the impact on a family here in the near term. Got a couple questions on MWR and services. So this one is, are gym patrons allowed to walk around common areas while moving from equipment to equipment or workout area without a mask? Can you clarify the mask requirements at the gym? Wear a mask while you are in the gym. We recently made a change where while you're on a piece of equipment, you can take that mask off. I will tell you that the moment we have spread that occurs within our gyms, the gyms will likely have to close. So I'm asking for the community support in making sure that our efforts to keep the fitness centers open are worthwhile. Next question. We rely heavily on the Galaxy Bowling and Entertainment Center for meals as we are in quarantine at the Panzer Hotel. Is there anything being done to expand menu options or expand hours for delivery? So the Galaxy Bowling Center has recently added burgers to the delivery menu. Current schedule is 4 to 8 o'clock, 7 days a week. Of course, it's closed on federal holidays. So right now they're trying to find ways to expand the menu. I don't anticipate that happening in the near term, but they will be expanding delivery times through the month of November. So instead of 1,600 to 2,000, that'll be 1,100 to 2,000. So expanded hours for the Galaxy, because I know how many people in the hotel rely on them. Here's a question for DPW. Can you give us an update on the utilities work at Panzer Housing? Tired of not having hot water on a consistent basis. So Tuesday this week, the contract and the manufacturer replaced 2 of the smaller vessels that were part of the problem that has continued to contribute to the hot water. On the 3rd of November, the larger membranes and other parts that were damaged during the overpressurization of the system will be replaced. So I am looking forward to the 3rd of November as much as you are. And we'll continue to monitor those repairs once they're in place to ensure that we don't have any more pressure issues that result in the loss of hot water now that we've connected to the district heat and hot water systems. Ames asks, I have a concern for families searching for off-post housing. Each time I view a property, I come into contact with an average of 4 people outside of my bubble, i.e. the realtor, current tenants, taxi drivers. I viewed 5 properties in 4 days. Those who are in processing, even with virtual aspect applied, have a heightened rate of exposure. Is there anything that can be done to further mitigate the risk of infection? So Ames, there's only a small piece of that the garrison owns, and we have, through our contract that does all of the interaction with landlords, has transitioned that element to a virtual process. In many cases, the landlords out there are willing to do a virtual showing and to meet you virtually and make a decision as to whether or not they want to rent their home to you virtually. But there are still many that are not willing to do that without having had a chance to meet someone face to face. And so, short answer is we've made some strides in the areas that we control in terms of the use of a taxi or public transportation. In order for you to go and see something either on your schedule or on the schedule of the landlord that is outside of where your sponsor can support, I'm not sure I'm going to be able to assist much more than what we've done. So this registration season is changing. Temperatures are getting colder. Will vehicle registration be implementing any measures to help those people who are waiting outside as walk-ins? So talked about that with the DES just in the last couple days. Talked about it this morning specifically about moving heaters over there, and of course having tentage that will not melt if we have heaters over there. And so once we get the safety compatibility issues in place, then we will put something in that helps helps add something other than dress warmly to the equation as you wait hopefully for a very short time to go in and do what you need to do from a vehicle registration standpoint. I will highlight that if you're attempting to walk in the afternoon, there are much shorter waiting times than in the morning. Okay, those are all the questions that came in early. What other questions have come in?
Sir, quite a few questions have come in as you've been talking about things, so a couple of them we may have to reiterate some of the points. Quite a few people are asking about the gyms. They're expecting the post gyms to shut down as of November 2nd. If you could reiterate some of the information on the gyms, will that be the case? Are they planning to close?
So I know that the gyms is something that we've made huge leaps and bounds in terms of keeping them open, making them safe. The efforts to especially as the weather is getting colder, to have an option to maintain some strength and conditioning. So the intent is to, as much as possible, keep gyms open. I think we make a compelling argument when it comes to the mission aspects of fitness centers and the readiness aspects of fitness centers. And I will be quick to compare the standards that are in place for the German Army and the German police forces when it comes to what they do to maintain readiness, maintain their fitness levels. And so those are the questions I'm asking. We're talking to Bundeswehr elements here in Baden-Württemberg. The same conversations are happening across Europe, and the effort across all installations is to find a way to keep fitness centers open, but keep them open safely.
And sir, quite a few questions about travel. Kathy asks, can I go to Poland for the weekend?
Kathy, don't go to Poland. Not at all. The ask is that you stay home and you, instead of having interactions with 4 people in a day, find a way to do that with just one person. And so even if you have family, local, state, federal officials have said, don't travel. That's how the virus has spread. We are where we are now because we traveled in August. Traveled across Europe, traveled within Germany. And so we're reaping the results of travel. We have imported the virus from other locations. We had 0 cases in this community. That's not the situation today.
Several questions about students who are on orders at college, who have SOFA stamps in their passports. Can they travel? Can they come back to Germany?
So if you have them on your orders, they already have a passport, an official no-fee passport with a SOFA stamp. That one, I think, is already going to be in play. I don't anticipate that you'll find a ticket agent or a border police official that will stop that student from coming back. The focus, from my perspective, is on those students that aren't on a set of orders and don't have a SOFA stamp and don't have several things that say, hey, I need to come here to be, otherwise I don't have housing. So those are the things we're working through now. and trying to find creative ways to make sure that we can solve that problem so we don't have students stranded as their universities close back in the States.
So the next couple questions are about the youth and children in our community. Nicole asks, are they going to open up more spaces in the child care facilities?
So Nicole, short answer is yes. We're bringing on more staff right now, finishing the training. I think the 15th or 16th of November is where we are looking to expand with the current staff that we have hired. And as I've talked to our Child and Youth Services team, I think that allows us to bring back all of the kids that we weren't able to bring back to care when COVID hit us in the spring. That's still not anywhere close to what we had before COVID. But that's the mark on the wall, and where possible, we continue to bring children into care based upon their placement on the MCC.com prioritization list.
Dot wants to know, will the playgrounds close?
I don't see us closing the playgrounds right now. Again, I'm relying on parents, especially as noses start to run faster than the kids, to be out there and supervise kids out there playing with each other, because we do have incidents of child transmission, and it's a child playing with another child. Doesn't happen in the school, and there's enough structure during recess that we haven't found incidents where spread occurs during recess. But the play dates after school, the time spent together indoors is primarily the cause of spread between kids. We haven't found where playing together outside has done that, but at the same time, I think we have a lot of kids that are wearing masks when they're playing together outside as well.
So the next question is about telework. Allison asks, will we be abiding by the host nation guidance about teleworking whenever possible?
Well, Allison, there's lots of variables with telework. First of all, do you have a job that allows you to telework? You can't telework to combat. Our plumbers can't telework. And so it kind of depends on what your job is. And then it depends on whether or not you have the tools available to telework and you've done the training. I think we've learned a lot about our labor laws and what's authorized when it comes to working from home over the last couple months. And so there are different commands across this installation and different decisions based upon the what guidance those commands have received. And so ultimately it's going to be a discussion that you have with your supervisor as to whether or not telework is possible. So the guidance across Germany is, where possible, telework, because that reduces the amount of contact you have with somebody else. But there's quickly after that guidance the caveat that that's not going to be possible for many people that are in the workforce.
Sir, a question about the mail. How is the APO and the CMRs going to handle the Christmas rush?
So, good question. First of all, we've brought in a couple of additional seasonal hires. We've refined our processes. We've added a couple pilot programs, specifically on patch barracks with 2 units where they have mail handlers that receive all package mail out of the back door. So 2 people prevent 200 from coming to the counter and getting their packages. And those packages, when they arrive, are delivered to those individuals. And so that's a program that worked well for us, especially in the spring when we had to reduce operations significantly in our mail rooms because we had staff, we had people that are our postal employees that were impacted by a positive case. And so we'll expand that program where possible, and we're adding more people to create some redundancy. I don't we'll expand hours as well, especially as we get into the heat of the holiday season. But I don't see it being a way that it doesn't change the dynamics of our post office. It doesn't make them bigger. It doesn't make them able to store more. It doesn't allow me to put more people in the back behind the counter in a way that's informed by COVID and safe to them as members of our team. And so it's going to be difficult. There's going to be long lines. There were long lines last year. But we're working to try and alleviate the additional demand, especially now we've seen Christmas in the fall. As more people, their purchasing habits have changed. You're getting more via Amazon and other .coms delivered to your APO. and CMR.
Sir, several people, Deb, Mike, Rena, and others, are asking, are we going back to red, white, and blue?
Deb, Mike, Rena, others. My intent right now is not to go back to red, white, and blue. The point where we had to go to red, white, and blue was when we had no way to clean our hands. We weren't wearing masks. We had sustained community transmission, and we had asymptomatic people. A test that proved that 1% were walking around all day, every day, spreading. And the only way we could break that was with a deliberate break in how we interacted in the community. The mitigation that we have in place now in our service areas, in our community spaces, in our workspaces, the knowledge that people have about how to protect themselves, how to protect their families, how to protect the community, that's different now. And so for those reasons, I don't see us having to limit our access to services, to facilities. I don't see risk associated with our commissary and APHES associates being healthy enough to come to work. Same thing with our mail rooms. So those are the things that I'm continuing to monitor each and every day. And if we see things where risk is changing, then we'll make some modifications. But right now, I think we have the mitigation in place that we didn't have in the spring that prevents us from having to do what we had to do in the spring.
Sir Manuel asks, can we have more town halls since cases are going up in our community?
Manuel, yeah, we can have more town halls. I know we try to offset, virtual town halls with when I'm on the radio and the ability to chop that, record that and chop that up so that it's then available for the community. And then I always have the ability, as things change, to do a short video and push it out via social media and other means. And so if the need is for more information from more venues like this, then that's what we'll do. And I'll take my cues from the community, and if that's what you want and what you need, then I'm happy to sit up here.
And sir, our last question for the evening as we get about the 45-minute mark. Jeremy asks, how can members of this community help? If we come together, we can overcome this quicker.
Jeremy, I agree. I do believe that the overwhelming, the overwhelming way forward for this community is to, hey, let me know how I can be part of the solution. And so always looking for volunteers. I know that if there are volunteers that have some medical experience, that we found a way through the Red Cross to get them into the clinic and doing things, perhaps not linked to COVID, but perhaps linked to well baby appointments, something that we might not be able to do or perhaps might not be able to do at the level that we would want or need to do it. Likewise, we've got more people that are in isolation and quarantine. So we always need more volunteers that are willing to go, do some grocery shopping and deliver it, deliver it to somebody's door. We figured out how to deliver virtually a shopping list and then find a way to make payment, at the cash register with a phone call that prevents some sort of exchange or figuring out how to get money back and forth. And so those are the kind of things that we're looking for. And so, we've got a great volunteer coordinator over at ACS. Reach out to Charlene. She will let you know where you can, have an impact today. And I think the other thing is, hey, it's going to take every one of us to, first of all, check ourselves, make sure that, the mask is up over the nose as well as the mouth. To take that extra 5 seconds to wait for the person that's standing in front of the hand sanitizer dispenser to get their hands sanitized and move out of the way so that you can then do that. To remind someone in a way that doesn't create a conflict that, hey, you're as you move from one piece of equipment in our gym to the next, put on your mask. So there is a way to do all of these things that I think contributes to the solution that we're trying to get to. It will help us reduce infection within the community. And so, I want to close tonight by saying, I appreciate the questions, some great questions that came in. There's a lot of thoughtful people out there that are approaching the problems that we have as a community with in a constructive way, and the ideas have been fantastic, and we're looking for more of that because things are changing, and there absolutely are better ways to do the things that we're doing. We've had some experts out there that were likely answering these questions before I got a chance to, and so I want to say thank you to all those people, whether it's a school teacher out there, a principal, assistant principal, a nurse, somebody that works in the clinic, our postal team, they are out there each and every day. And I also want to, stop and take this opportunity to ask you to, as I need you to help take care of each other. So we've got telework, alternate work schedules. We've got families here that are incredibly stressed. We've got families back home that are stressed, and it's creating some new and unique pressures that, though we experienced it in the spring, it still doesn't make it any easier now. So check on your neighbor, check on your coworker, check on your friend across town. Make a phone call, do FaceTime, do something that allows you to look in somebody's eyes and ask the question, are you okay? And if you get a single hint that something is not okay, make sure that you stay with it until you're done. And so conditions will continue to evolve quickly, and as soon as we get more information, we'll provide that to the community as quickly as we can. Thanks, and have a good night. And remember, every day is COVID day until it's not. Stay vigilant, stay healthy.